Hello there, Mr. Yealland. I brought you here to the present so you could tell us your first-hand experiences in World War I. Would you mind answering a few questions?
Why sure, sir, that would be cheery.
Let's start off with a little bit about you. What is your full name and where were you born?
My full name is Louis Ralph Yealland, and I was born in Canada in 1884.
Interesting. How did you end up getting involved so closely with World War I?
I moved to Britain to practice medicine after I graduated from the University of Western Ontario. From there I decided to help patients with shell shock.
What exactly is shell shock?
Shell shock is a set of physical and psychological symptoms in soldiers caused by the extreme stresses of war.
You talked about helping patients with shell shock rather than treating them. Do you believe shell shock is an illness?
No, I do not believe it is an illness. I believe it is the soldiers' fear and they just do not want to go back into warfare. Shell shock is due to a lack of discipline.
So, where was the place that you helped these soldiers?
I was based at the National Hospital for the Paralysed and Epileptic in London.
What are the noticeable signs if a person has shell shock?
Well, usually soldiers with shell shock will claim to become tired easily, irritable, have low concentration, become giddy, and have headaches. In some cases, the soldier will have a mental breakdown.
So, what do you do to help soldiers with shell shock?
Honestly, most of the work I did with the patients was all experimentation. At the time, doctors did not know what to do about the dilemma. The first method I used is called autosuggestion. Autosuggestion is the practice of suggesting thoughts to oneself or someone else in order to change their behavior. In other words, I would repeat how I wanted the soldiers to act and they would start to believe what I was saying.
That is fascinating. But what if autosuggestion did not work?
I would then have to turn to harsher methods. I would conduct shock therapy on the most difficult patients.
That is harsh. Did it pain you to have to do such experiments on the soldiers?
No, not at all. All my experiments were based on punishment for the misbehaving soldier. They are cowards if they would make up an illness just to get out of the front lines.
My goodness. You have very strong beliefs on this subject. What other harsh methods did you use on your patients?
There was many men who ended up becoming mute after extreme warfare. I tried telling them that they can, and must, get better, but that did not work. So then I proceeded by giving them an electric shocks to the backside of their throats and to the outside of their necks. They ended up showing great improvement in their speech abilities.
That sounds excruciating and awful, but it is quite amazing that they showed improvement.
Well, my reputation is curing men quickly and getting them right back in the trenches. I pride myself in that.
How did people react at the time when they heard of what you were doing?
Most of the experiments were kept a secret for confidentiality. Although, some psychiatrists completely disagree with my beliefs and do not think how I helped the soldiers is how it should have been done.
Well, today most people think what you did was inhumane. But many realize that not as much was understood about illnesses back then.
Well, I stand by my beliefs even if people object.